Welcome back to episode 3 of Outcomes by Design. I'm your host, Dr. Kristin Bear, and today I'm joined by Samira Lowman, Chief Human Resources Officer at Onsera. Samira brings a truly rare perspective to the weight loss conversation, one that sits at the intersection of employee well-being and the fast-moving world of GLP-1 medications. As these drugs become more prevalent in the workforce, HR leaders are suddenly finding themselves on the front lines of some really big questions. Should employers cover GLP 1s? If so, how do you support employees through the journey without overstepping? And what does a thoughtful, sustainable benefit strategy actually look like in practice? Samira has been navigating all of this firsthand, and she's here today to share what's working, what isn't, and the practical steps employers can take right now. Whether you're an HR leader, a benefits manager, or just someone trying to understand how GLP 1s are reshaping the workplace, this conversation is for you. Samira, thank you for coming on the podcast today. Do you want to give our audience some background information and share how you came to be the CHRO at Onsera?
Sure, Kristen. Thanks for having me, and thanks for setting up this conversation. It's so important today to be able to have to share this type of information. So, hi everyone. I'm Samira Lowman. I am, as Kristen said, the head of HR for Onsera. Like most people, my path to Onsera isn't linear and straight. I started my career with a master's in public health, where I really wanted to be able to be in a role where I was impacting the healthcare system. I started that journey actually on the benefit side, in benefits consulting, where I really got a deep education in how employer sponsored health plans work, how they're funded, the economics of them, how they're designed, and really truly the gap between what employers think they're delivering and what employees are actually experiencing on the front line. That foundation really gave me an appreciation for how to think about benefits and the benefit landscape, and how to get it right for employees. I saw firsthand how technology could transform access to care, but I also saw how fragmented the solutions were out there and how we really needed to start thinking about health and wellness differently for our employees.
So, how do you balance investing in employee well being and managing costs?
Well, what I'd start by saying is I try not to look at it as a trade off and truly thinking about it as when you get it right, it shows that investing in employees is managing costs. So here's what we know: when employees are healthier, they are more productive. When employees are more productive, they are at work, they're engaged, they're delivering. And all of that is a return on back to the employer on their investment in employees. And that's the way we need to look at it. It's not a short-term cost. It really is about how are we investing in employees, and all of that has a downstream impact to a P&L. But to make the case internally, employers need to be thinking about the value. And that's where a lot of programs fall short. They can tell, they look at enrollment numbers, they look at total cost of claims, but aren't looking at the longer term and how to actually connect dots to productivity, retention, talent acquisition, and then eventually the cost of claims and how you bring all of that together. And the truth is, many HR functions can't actually measure a lot of those costs, upfront or downstream. And if you can't measure it, you can't manage it. So we really try to look at how you bring all those pieces together, and have that conversation with your CFO.
I love that framing. And what I'm hearing through that is presenteeism, right? Employees that are healthy and feeling good, feel valued, they're more present at work. And in the age of quiet quitting, that's becoming more and more important. So I love not looking at employee well-being and managing costs as two separate competing priorities. It's really one and the same.
That's right.
So, how should employers be thinking about the ROI conversation internally?
I think actually, honestly, the ROI conversation needs to be at the center of everything. And it really needs to be a focus on the reduction in comorbidity costs, not the increase in benefit costs. Obesity isn't just one condition. It really is the gateway to a lot of other claims costs. And as you know, Kristen, we think about it as the trunk of the tree or the tip of the iceberg. But really, it's a gateway to a lot of other chronic conditions. And those chronic conditions also then have an impact on benefit cost, as well as, again, productivity and absenteeism, and how employees feel about themselves and being at work. Type 2 diabetes, hypertension, cardiovascular disease, sleep apnea, certain cancers, joint pain and surgeries, all of those, again, are the comorbidities and the downstream costs of obesity that we need to be looking at. So when you look at an employee population, managing weight or obesity is not what the focus should be. It should be absolutely about the long-term care and health and well-being of this employee population.
Exactly, I completely agree, and when we're treating obesity, it's not for cosmetic purposes, right? It's to make our employees more healthy, prevent downstream, healthcare complications and costs that are associated with that. So, it's not just a weight loss program, right? You're really investing in long-term health for your employees. And so, what are 2 or 3 kind of watch outs, for other CHROs when evaluating programs?
Yeah, I think that's a great question, Kristen. I think every CHRO looks at their organization differently, and obviously, it's the context of the business that's important when evaluating these programs. But I'd probably highlight three things. Number one, looking at the short-term costs again versus the short-term costs and the short-term outcomes versus looking at the long-term investment. Um, when a vendor comes in or a partner comes in with a 3 to 6 month um, spend or ROI and looking at, hey, here's what we can save you, or here's how much weight your employees are going to lose, that's the wrong way to be looking at it. um, we need to be looking again at those chronic conditions, the cost of the journey over 12, 24 months. How are we sustaining the weight loss and having longer term impact um, on claims costs and on employee health and well-being? So it's that long-term view versus the short-term trade-offs that we need to really be focused on. Secondly, I would say the market has had an explosion of point solutions. And they're all great and they all solve a certain problem. But when you're evaluating these partners, looking at it at a solution by solution is a really hard way to look at it from a CHRO's perspective. So I think really thinking about it as more around that sort of integrated landscape of how are we taking care of our employees? How are these partners coordinating with the employees' primary care providers? How are they coordinating with the other care that's happening around them? And how do we ensure we're not just standing up another point solution that isn't either going to get utilized in the way it should be or really truly have the impact on an employee's well-being that we're asking it for or hoping that it'll have? And then lastly, not thinking about support. Right now in the industry, there are so many companies out there where you can get access to the drug. And that's not what Onsera is about, and that's not what we believe should be the right answer for employees. We really are talking about how do you build the support, again, for that long-term outcome, the long-term sustainable health and well-being of our employees, versus just getting access to a drug and not thinking about them holistically and what they need holistically.
There's a lot of good points in there. What I think is really top of mind for me as a clinician is the integration of the care. When you have so many point solutions, you don't know what the patient's care looks like outside of what you're providing, and having the collaboration with between the point solutions and the integration of care, I think is so important for looking at the patient holistically, as you mentioned, and also preventing medical errors. So I think that is a huge thing to watch out for, and the support as well. Looking at the patient as a person and not just a condition to treat. So, from your HR perspective, what does a truly best in class weight loss benefit like on Sarah look like in
Yeah. I
2026?
think we've covered some of it, but I think if I think about what Onsera is building, I think there are a few really great differentiators. I think the first is starting with an opportunity assessment. And what that means is we are able to go to CHROs, to CFOs, and say, let's take a look at your claims data. Let's take a look at your population, and let's make sure we understand where the highest risk and the highest ROI lies in your population. And let's be very targeted and focused. And this is having a conversation with a CHRO or a CFO at a real level. It's not theoretical. It's based on their claims data. It's based on saying, hey, here's what we can do for your population. Now let's take a look at it and see how we can make this partnership work. So it's grounded in real data. Again, not theoreticals. Number two, I would say it offers end-to-end clinical support, right? As we've talked about already, it's not about just the drugs. It's about how do we ensure that employees have the sustainable support around them? How can we give them the nutritional support, the behavioral support, all the clinical support that they need to get through something that's incredibly difficult, and that we want to be there for them beyond just supporting them with the drug. I think that it's really important to think about that entire ecosystem around them, not just, again, the drug. And then maybe third, AI enabled. I know AI is something everybody's talking to, and a lot of um, digital health companies, a lot of companies out there are looking at AI more from an operational efficiency perspective versus truly starting as AI native and AI enabled. And so really what Onsera is trying to differentiate itself with and doing is thinking about it from the beginning. How are we leveraging AI into our programs? How are we leveraging technology to really personalize care at scale? Matching members to the right interventions, predicting who's at risk of dropping off, optimizing the right number of touch points based on where they are in their care journeys. But it's clinician led, obesity certified physicians, nurse practitioners, registered dietitians, certified health coaches, with AI augmenting and enabling, building around incredible clinicians that are delivering this important care.
Yes, AI and GLPs together are quite a hot
That's
topic
right.
right now. And, so many companies are looking at it from the perspective of just improving efficiency. But there is so much more that AI will enable us to do to improve outcomes for patients and also act as a safety net, detect patterns and things before most humans can, or that clinicians have the capacity to in busy practices. So I think the AI native platform is something really unique and something emerging in this space that I think is going to bring a lot of value to employers as well. And so beyond the drug itself, we know these drugs work. What does that support infrastructure around GLP-1 therapy really need to look like for employers to actually see outcomes and not just spend?
I think really, again, maybe double clicking on two things that I think matter. First is employees need those tools to be successful. Um, that means clinical support for titration, for side effects, for ongoing monitoring. It means nutrition guidance to help them eat in a way that supports the medication's effects. It means behavioral coaching to build habits that will sustain them, even if eventually they come off the medications. Um, it's just, you can't just hand someone a prescription and say, "Good luck." You wouldn't do that with any other medication, so why would you do that with a GLP-1? And it's just as important to stay there for them through that journey. Um, Second, again, we talked about it. I think that the program needs to integrate with the broader healthcare system and the benefit system. And so, how does that integrate with your medical plan, with your PBM, with other care that you have going on in other point solutions? And so, I think that this weight management program, again, is a piece of a really big puzzle that we need to make sure we bring all those pieces together so that we're looking at care more holistically for the employee.
Yes, I completely agree with that. And I think one of the top concerns employers have is the cost of GLPs. These medications prohibit a lot of people from accessing them due to cost. And so, from your perspective, why would a weight loss solution still be beneficial to an employer when the price of GLP medications come down?
Yeah, I think it's such an important question because I think some employers are waiting on the sidelines to also see what happens with the cost of the drugs and what do we do from there. And I think Kristin, you probably know this better, but I think I read a data point somewhere that said that only 14% of employers actually offer programs with a wraparound. And so a lot of employers are questioning adherence and the success of these programs, but I'm not sure they're thinking about them in the right way with this broader support. Here's the reality. Again, access without support isn't going to get you very far from a sustainability and an adherence perspective. Um, we've talked about it, right? You can't just put out the drugs and then not give employees or people the support that they need around this. They need the support around behavior change. They need the support around nutrition. They need the support again around all the other health issues they may be having in their lives, and the fact that these GLP-1s will change everything for them, and this needs to be integrated in a broader picture. Um, Support coordination again is going to help them stay on the drugs, help them stay healthy, and keep them on the right path. So the cost of the drug coming down truly is great from an access perspective, but that's not going to have the impact on, again, the long-term sustainability and health and wellness of the employees. So, again, as we've sort of said, you wouldn't put somebody on insulin and then just wish them well on how they use the drug, but actually they're still going to need care and support beyond that. And so I think that the cost of the drug is just one component of it. It truly is. As the cost of the care comes down, we can increase access, but we have to also increase support around around the patients and employees.
Yeah, and I think the diabetes comparison is such a good one. Because obesity is a comprehensive or chronic complex disease, and it really does need more than just one tool to successfully manage it. Giving someone the medication without support is not going to yield the best outcomes, and it's almost a reversal of your investment as well. Because if they stop the medication because they're unsupported, all their health issues are going to come back.
That's right.
And so, yeah, protecting that investment is important with that wraparound service. So, Samira, in 10 seconds or less, what thought do you want to leave with other CHROs who are debating whether or not to have a weight loss solution?
Approach the conversation with your CEO or your CFO with a long-term investment mindset. Frame employee well-being spend as a multi-year investment, not a single year expense, not a cost. Focus on comorbidity cost reduction and obesity as a gateway to expensive chronic conditions. And that's where the ROI lives. And that's where employees will see that you care about their health and wellness over the long term.
Great. Well, this was a very helpful conversation. Thank you so much for joining us today, Samira. And I hope our audience out there found value in the conversation. And we are looking forward to our upcoming episodes with guests from various backgrounds to continue the conversation here at Outcomes by Design. So we'll see you all next time. Thank you.